Yes, because based on my research, having an STI can increase your chances of getting HIV, the virus that causes AIDS. The organ system that is being affected having an STI are the mouth, genital, and the anal areas of the body. To avoid STI, you must limit the number of people you have sex with, getting tested along with your partner before having sex, and avoiding sex under the influence of alcohol or drugs.
If I happen to have STI or sexual transmitted infection, can it lead to AIDS? And what organ system is affected? And what should I do to avoid this? So having STI or STD can increase your chances of getting HIV, the virus that causes AIDS. This affects your immune system, the system that fights infection and diseases. To avoid STI and AIDS, choose less risky sexual behaviors, like reduce the number of persons you will have sexual activities with, and also always wear protection.
If I happen to have STI, sexual transmitted infection, could this lead to AIDS? And what organ system is affected? And what should I do to avoid this? Yes, STI or STD could lead to AIDS. STI affect the mouth, reproductive system, and other areas of the body. To avoid this, use condom correctly every time you have sex. These infections are usually passed from person to person through vaginal intercourse. They can also be passed through anal sex, oral sex, or skin-to-skin contact. Since most STD or STI can be cured, people think doctor give you a medicine and that is the end of it, right? Well, not quite. Having an STD or STI can increase your chances of getting HIV. The virus causes AIDS.
If you have STI, it has the chance that it will turn into a disease that increases the chances of getting HIV, a virus that causes AIDS. This infection always involves the lungs. The other organs that will be affected are the eyes, digestive tract, kidneys, lymph, and brain. It also affects the white blood cells. To prevent this kind of diseases, first, must avoid having different sexual interaction or orientation. Use condom to reduce the risk of infection. And the most reliable way to avoid this infection is not to have sex.
I am from the Endocrine System Group. Rheumatoid arthritis is a systemic illness, which means it affects multiple organs. Well, in skeletal system, inflammation, which is a common symptom of rheumatoid arthritis, causes joint discomfort and swelling, as well as cartilage destruction, which leads to bone erosion around the joint. There are some exercises to avoid rheumatoid arthritis. Number 1, aerobics, like walking or swimming, to get your heart moving. Number 2, strength training to keep the muscles around your joints strong. Number 3, range of motion exercises to help your joints move like they should. Number 4, balance moves to help you avoid stumbles and falls. Can this illness be avoided? Why or why not? It says there's no known way to prevent rheumatoid arthritis because cartilage is avascular. Once it has been damaged, it cannot be restored, making a cure nearly unattainable. It appears that once an inflammatory rheumatoid synovial organ has formed in a joint, it is unlikely that this tissue can be brought back to normal.
So what are the organs that are affected by rheumatoid arthritis? So in some people, the condition can affect the skin, eyes, lungs, heart, and blood vessels. So what should we do to avoid this? So to lower the chances of having this is we should not smoke, we must limit our alcohol, and we have to maintain a healthy lifestyle. So can this illness be avoided? No, we cannot avoid rheumatoid arthritis because Rheumatoid arthritis is an autoimmune disease and it occurs when your immune system mistakenly attacks your own body tissue.
Rheumatoid arthritis is a type of arthritis that causes swelling and deformities of the joints. When the body senses danger from a virus or an infection, the immune system kicks into gear and attacks it. This is called the immune response. Sometimes healthy cells and tissues caught up in this response, resulting in autoimmune disease. It's a condition causes the body's immune system to attack the protective lining of the joints. This may affect your skeletal system. Initial inflammation can lead to long-term joint damage and joint deformities. Inflammation can also affect the bones, contributing to the loss of the bone mineralization. According to Centers of Disease Control and Prevention, in order to lower your risk in getting this illness, quitting smoking greatly reduces the chances of getting rheumatoid arthritis later in life. There is no way to prevent rheumatoid arthritis, but you can lower your chances if you quit smoking and exercise regularly.
Having rheumatoid arthritis not only can cause inflammatory disorders that affects your joints, but also damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. Sadly, this cannot be prevented, but we can lower the chances of getting this illness by quitting smoking. This illness cannot be prevented because the immune system itself attacks the healthy body tissue and no one knows yet what triggers this. Once this disease occurs, it cannot be repaired and it also makes the disease get worse faster and lead to more joint damage, especially if your age is 55 or younger. Thus, making a cure is essentially impossible.
Stomach acid or gastric acid is a watery, colorless fluid that's produced by your stomach's lining. It's highly acidic and helps break down food for easier digestion. When these scatters on your digestive system, you can have this by examples. If you will have a high level of stomach acid, it can lead to heartburn, acid reflux, and eventually ulcers, while low levels of stomach acid may impair your ability to digest food. Seek medical attention if you are showing signs of low or high acid because both of these can be problematic if they're chronic and not treated properly.